Mr. Schneider.
Thank you, Chairman Johnson, Ranking Member Merkley, and members of the committee. Appreciate the opportunity to testify. So let me tell you about CCF, the Center for Children and Families. It's an independent, nonpartisan policy and research center founded in 2005 with a mission to expand and improve high-quality, affordable health care coverage for America's children and families. As part of the McCourt School of Public Policy at Georgetown University, we conduct research, develop strategies, and offer solutions to improve the health of America's children and families, particularly those with low and moderate incomes. CCF is responsible for raising external funding to conduct our work. The full list of our current funders is available on our website. CCF does not accept any government, foreign, or corporate funding. Our work is funded primarily by philanthropies. The testimony and views I'm presenting today are my own, not those of Georgetown University or the McCourt School. Here's the reality of Medicaid. It's a hugely important health insurance program for 67 million low-income Americans. It covers nearly 40% of our nation's children, nearly half of all children with special health care needs, and 40% of births. It's also the largest payer for long-term care services and supports for people with disabilities and seniors, accounts for 3/5 of long-term care spending. It's particularly important to children and families in rural America and to hospitals and physicians that serve them in the communities in which they live. Non-elderly adults and children in small towns and rural areas are more likely than those living in metro areas to rely on Medicaid for their health insurance. Medicaid means access to needed health and long-term care services, as well as protection from medical debt for children and families, and for all the other populations it serves. So it comes as no surprise that Medicaid is very popular with the American people. A January 2025 KFF tracking poll found that 77% of voters had very or somewhat favorable views about Medicaid, including 63% of Republicans and 81% of independents. In my written testimony, I discussed the role of Medicaid in our healthcare system. It's important to children and families, the harm that last year's budget reconciliation bill will do to millions of Americans who rely on Medicaid for access to health care and protection against high health care costs, and the reasons for federal and state spending, why that spending is growing. I also explained that actually reducing fraud against the Medicaid program requires collaboration between the federal government and the states, not withholding federal funds or partisan attacks. In closing, I want to sound one alarm. We at CCF closely monitor child enrollment in Medicaid. Our latest tracking, updated as of last Friday, finds that since January 2025, the number of children enrolled in Medicaid has dropped by 2.3 million. That's 2.3 million. That's as many children as in the states of Alaska, Delaware, Maine, Montana, New Hampshire, North Dakota, Rhode Island, South Dakota, Vermont, Wyoming, and the District of Columbia combined. This is a statistic that should alarm every policymaker who cares about the well-being of children. We know that declines in Medicaid coverage mean increases in the number of uninsured children. We know that uninsured children are children without access to preventive or primary care. We know that their families have no protection against medical debt if their children become sick or injured and need to go to the emergency room. At a minimum, CMS should be working with states to understand the root causes for this trend and take immediate steps to reverse it. Instead, CMS leadership seems laser-focused on withholding federal funds from California and Minnesota, $2.7 billion and counting, through repeated deferrals. That is the reality of Medicaid today, and it does not have to be this way. I hope the members of this committee will work with CMS to change course. I look forward to your questions.
Thank you, Mr. Schneider. Mr. Blaze, let's quick address that issue. The 2.3 million children that have lost coverage under Medicaid. Can you explain that?
Yeah, it's a deeply misleading statistic. If you look at combined Medicaid and CHIP enrollment from before the pandemic to 2026, there's actually a higher percentage of children on Medicaid and CHIP in the first part of 2026 than before the pandemic. One of the issues is we have fewer we have fewer births in the U.S. because of the fertility decline than we have children who are moving off the Medicaid program because they age off of it. So when you account for those factors and you look at it as a percentage of all kids, there's actually a higher percentage of kids enrolled in Medicaid and CHIP than
Okay,
before
well, I
the
appreciate you
pandemic.
explaining that. Mr. Schneider, there were 4 primary reforms in the first reconciliation package. The first one was requiring states to redetermine eligibility every 6 months rather than a year. Do you have a real problem with that? I mean, do you want people who are ineligible to be on these programs?
I believe that the program should be only for people who are eligible.
So is there anything wrong with states redetermining eligibility? Because a lot of states obviously don't. They haven't been.
I think the state should have some flexibility in how they administer their programs. The previous
You're not answering the question. I mean, is there a problem with rechecking eligibility?
There's not a problem with
There's nothing
rechecking.
draconian about that, correct?
There's not a problem with rechecking
Okay,
eligibility. It
good. Next, are provider taxes and provider fees, is that healthcare?
States are sovereign political entities.
Is that healthcare?
Healthcare is in part how it gets
The
paid
answer
for.
is no. Mr. Blaze, so when states charge a provider fees and taxes, correct? For a Medicaid recipient, the provider gets reimbursed that amount, right? But again, the states are charging that for services across the board, correct? So isn't it true then those provider fees and taxes artificially drive up the cost of health care for people on private insurance or for people on Medicare?
They do. We actually have a study from looking at a tax that California imposed that it increased commercial prices by about 4%.
So isn't it true that, and you said in your testimony, President Biden called that a scam. President Obama recommended doing exactly what we did in the One Big Beautiful Bill. That's not cutting and slashing Medicaid, right? That's just actually implementing what both President Biden and Obama recommended.
That's correct.
So that's the second reform, the One Big Beautiful Bill. State-directed payments, I mean, this one is kind of baffling. Can you describe a little bit more what that is? And intergovernmental transfers, where the states plump up what they charge or reimburse, like their ambulance, their state-owned ambulance services. I mean, can you describe that?
Yeah, so let me do state-directed payments first. On the fee-for-service side of Medicaid, there is a cap at Medicare rates. It's called an upper payment limit. That cap does not exist on the managed care side. So as states have moved Medicaid enrollees into coverage through insurers, they've realized that they can create these provider tax and financing gimmicks, get the federal funds, and then lavish much higher payments on the big hospital systems. So what the One Big Beautiful Bill did was extend the limits that were on the fee-for-service side of Medicaid to the managed care side.
So Mr. Schneider, does it make any sense to you whatsoever that for every dollar a state spends on a disabled child or blind elderly individual, they get reimbursed, again, in the federal match, they get reimbursed $1.33. But for every dollar a state spends on a single, childless, working age, able-bodied adult, states get $9 in reimbursement from the federal government that's $40 trillion in debt. Does that make any sense at all, that disparity to $1.33 for a disabled child, but $9 for somebody who in many cases should be working? Does that make any sense to you at all?
It's a policy choice that Congress has made. There's similarly, there are differentials.
Again, that's not the question. Does it make any sense to you? It apparently didn't make any sense to President Obama because he recommended equalizing that treatment, correct?
He did. In a 2012 budget proposal called the blended rate proposal, he proposed equalizing the match rates.
Now, would he increase the reimbursement for disabled children, or would we just drop that to a reasonable level? Like, no, if we're going to reimburse disabled children for $1.33, that's what we're reimbursed for.
So he had it as part of a deficit reduction plan. It would have brought up the traditional federal reimbursements for those traditional categories.
You know
of
by how
enrollees.
much from $1.33?
I don't recall.
Okay, well, that's what I've got for the time being. Senator Merkley.
Yeah, thank you, Mr. Chairman. Can you tell us, Mr. Blaze?
Mr. Blaze.
Blaze. What is the federal poverty level for a mother and 2 children?
The federal poverty level for a household of 3 is probably around $25,000 a year.
Yeah, that's approximately right. And Mr. Schneider, is it hard for a mother and 2 children to live on roughly $25,000? It's slightly higher, it's $27,000, but close enough. Is it difficult for a mother and 2 children to live on that?
So you're looking at a monthly income of $2,000 a month, depending on the area of the country that the mother and child live in? Yes.
Yeah,
I
it's
don't
extremely-
understand how they make the ends meet.
Extremely difficult. And there probably aren't too many people in this room living at that level and struggling. And is it correct, Mr. Schneider, that when people are at that income level, it often varies tremendously in the course of a year because they get another part-time job, or the boss at one part-time job has a schedule arrangement that doesn't work with the other part-time job, or childcare problems intervene, so changes? There's a lot of fluctuation in the level of income.
That's correct, Senator.
And am I correct that Medicaid, for expanded Medicaid, covers 138% of federal poverty level?
For, in states that have accepted the option
That
for
accept-
adults? Yes, and
So that's 1.3 times roughly 27,000 or roughly $36,000. Still a very low income for a mother and 2 children. The point I'm making here is the chairman asked a question about reauthorizing the income level every 6 months. I will tell you, one of the enormous stress factors for very low income families is the refiling paperwork continuously, and the states have estimated that there's a massive overhead, and essentially people bump up, bump down with every little job fluctuation. And so I would say to my colleague, when you understand the challenge of less affluent families, certifying it every year might make sense. You get more often than that, and you're just catching the fluctuations and creating enormous anxiety of qualifying, not qualifying, qualifying, not qualifying, which doesn't serve low-income children or their families well. And I wanted to turn to this question of the impact on rural America. Is it correct, Mr. Schneider, that there are a lot more folks on Medicaid in rural America than in urban America? In terms of the percent of the population?
yeah, in terms of the coverage, yes, yes.
And am I correct that when you lose revenue at a rural clinic or hospital and it shuts down, that it affects everyone in the community because there isn't often a 0.3 million children have come off of Medicaid because of the big beautiful bill, or the big ugly betrayal, as better known in most parts of the country. And yet we heard testimony from someone else saying, oh, that's just an anomaly because children are graduating out of the program faster than they come into it because of low birth rates. Is it just an anomaly, or did that bill actually change the program in a fashion that is greatly reducing the number of children covered?
So let's separate two things. We're looking, when we track child health enrollment, we are looking at current data from CMS 6. The Medicaid child numbers, enrollment, went down from 30.1 million to 28.2 million. So that's a drop of almost 2 million. We say 2.3 million because we have some later data from some states. And
Okay.
that decline is very, very concerning. We don't know the reasons. We don't know the reasons on what has happened historically, that when the child enrollment rate in Medicaid goes down, the uninsured rate for children goes up.
Okay.
And we want to do whatever we can to avoid that.
So just one factual question as I close out, because I'm out of time. Am I correct, is Medicaid is the only health care program where the federal spending is shrinking as a share of GDP?
Sir,
You don't have
I
that number?
assume so. I don't have that information.
I do have
apologize.
that, and that is, the answer is yes. Thank you.
Thanks, Senator Merkley. The ranking member mentioned a family making $24,000. Senator Phil Graham has written extensively about families in that situation. In the 2025 Wall Street Journal column, he pointed out a single mother, single parent with 2 school-aged children making $11,000 would qualify for over $53,000 in tax-free benefits across the board. Again, $53,000 tax-free. So again, we want to help people. We want to help single moms, and we want to see children, make sure they have health care. But let's, again, talk about the facts. I mean, there aren't literally people only living on $24,000 who have access to all kinds of welfare benefits. Again, in this case, $53,000 worth. Senator Kennedy.
Dr. Blaze, before President Obama expanded Medicaid to include able-bodied working adults, traditional Medicaid covered the poor, pregnant women, people with disabilities. Is that correct?
That's correct, Senator.
And today, those people are still covered, are they not?
Correct.
And is it not the case that for those folks in traditional Medicaid, for every $1 that, this is an average, for every $1 that a state puts up, the federal government puts up $1.33. Does that sound about right?
That's
Average, the federal government for those, I'll call them Obamacare, Medicaid, expansion enrollees, for every $1 that the state puts up, the federal government puts up $9. Is that correct?
That's correct.
Okay. So if you're a governor, for traditional Medicaid, you can get $1.33. For Obamacare expansion enrollees, you can get $9.
That's the math that they face.
Right. Now, if you're a governor, you're going to try to get as many people on Medicaid through Obamacare expansion, are you not?
That is the incentive that states have, Senator, yes.
Do some governors cheat?
There are definitely some states that have a massive problem of improper enrollment. So people who would be...
Do some states cheat?
Yes.
Okay.
Many states cheat.
Now, the states determine, in accordance with federal rules, who's eligible for Medicare. Is that for Medicaid? Is that the case?
Yes.
Okay. Now they have to do it in compliance with federal rules, right?
There's the federal eligibility rules that the federal government does a very poor job of enforcing.
Do all states follow the federal rules?
No, they don't.
Some of them cheat, don't they?
Many of them cheat.
Right. Do some states just accept people's word that they make a certain amount of money and therefore qualify for Medicaid?
Yes, Senator.
We're going to cross-check your application with our state income tax records. Do all states do that?
Not all states do that.
Okay. If they did, they would find out that some people are lying, wouldn't they?
They would.
Now, what's your best guess as to how much per year this cheating costs the federal taxpayer?
We released a report on this yesterday, Senator, and estimated that it's $33 billion. It was $33 billion in 2024.
Okay. And that's $33 billion that is taken away from the people who really need Medicaid. Is that right?
Yes.
Okay. Has anybody gone to jail for doing this?
Not to my knowledge.
Don't you think we ought to start putting people in jail for cheating?
I think that it's financial fraud against the federal government, yes.
Sir, on the end, I'm sorry, I can't read your name. Sir, I'm sorry. Don't you think we ought to put people in jail for cheating?
Senator, I do not believe states are cheating.
You don't believe they're
I do
cheating?
not believe
All right.
that.
If they were cheating, what planet did you just parachute in from? Sir,
Sir,
you
I've
don't
worked
believe
on this,
states are
I've
cheating?
worked on this program for a long time.
But I'm be
It's
sure to
not
understand, you don't
perfect, but
believe
states do not
you don't
cheat.
believe states are cheating?
I do not believe states are
Do you
cheating.
believe in the tooth fairy? Sir? Do you believe in the Easter Bunny? Do you believe that Jimmy Hoffa died of natural causes? You're not answering.
I do not believe states are cheating in their administration of the Medicaid program.
Okay. I'm glad you have some water in front of you because your pants are on fire. I'm going to go back to Dr. Blaze. Tell me in the 13 seconds I have left, other than putting these people in jail, both the people who cheat and the bureaucrats who allow them to cheat, how else you would fix Medicaid?
So the key problem with Medicaid is that the more states spend, the more money they get from the federal government. So to set the certain amount that states get, and all state spending on top of that comes from the state, that would be an ideal reform. But I'd say a first order reform is to end the discrimination against the most vulnerable. There shouldn't be the federal government incentivizing states with 7 times more money for the able-bodied than traditional enrollees.
Sir, to the gentleman in the end, I don't mean to be rude to you, but if you really believe there's no cheating, you need to put down the bong. That's one of the most extraordinary statements I've ever heard a witness make.
Okay.
Thank you, Mr. Chairman.
Yeah, we'll move on. While we're on the topic, I just want to quick ask Mr. Blaze, do all states comply with the federal government requirements to provide information to the federal government to audit their results?
It's a very mixed bag. I think the information that states provide is often incomplete, and the federal government needs to do a better job of getting real-time spending information from states.
Which states are the worst in terms of compliance?
Well, in terms of improper enrollment in the
No, I mean,
ACA,
just in terms of not providing federal government information that's required or requested.
that I don't know the answer to, Senator.
Senator Kane.
Thank you, Mr. Chair, and thanks for holding this hearing. You know, this is an interesting one. There's that old parable about people with blindfolds on touching an elephant and all describing something different. And they're not necessarily inaccurate, but they're all describing something different. And I think there have been a number of charts that are probably accurate, and there have been a number of statements that are accurate. The 2 million decline of kids in a year and a half in Medicaid is an accurate number. I do believe some of that might be related to fertility. Some of that might be related to more aging out than being born. I doubt that equates to 2 million, but that's probably a factor we should get into. Here's the chart that I want to put up, and it's a chart of what's happening in Virginia. So I'm just going to spend my time talking about providers, and I bet some of you have a similar experience. Since the reconciliation bill passed, 12 hospitals or clinics in Virginia, and they're denominated in the red, they have closed, citing H.R. 1 as the reason. The Medicaid changes and H.R. 1 is the reason. And so these are the red dots on my map, and they include 3 primary care clinics and 6 school-based clinics, and then 3 hospital units, a labor and delivery ward in one hospital, an observation ward in another hospital, and I think a mental health wing in another hospital. So 12 closures in Virginia where they have announced it is because of H.R. 1. Now remember, the Medicaid cuts in H.R. 1 didn't go into effect until late 26 or early 27, but any institution has to run a budget. So they're going to run the budget for the next year, and they're going to look at what percentage of their patients are Medicaid reimbursed, and they're going to see there's changes to Medicaid. And so even in the advance of these cuts being made, we already have 12 closures. The Virginia Joint Commission on Healthcare, so this is not, some liberal think tank or whatever, it's the Joint Commission on Healthcare, has additionally come up with a list of hospitals. This is not hospitals and clinics, it's hospitals that are either at immediate risk of closure or at risk of closure. And those are the yellow dots on this chart. And so we've got about 25 providers in Virginia, half of which have already closed, and then the other half, the Joint Healthcare Mission says they are at risk or immediate risk of closure just because of the Medicaid changes made in H.R. 1. There's actually a CMS reg that's come out recently that extends H.R. 1's effect on state-directed payment beyond what was in the bill, and my hospitals are coming to me and saying this is going to compound it. So this issue is going to get worse because it'll get worse when the Medicaid cuts actually factor in, and if the CMS rule on the SDP program comes in, it'll get worse. Now, here's the reason I wanted to bring this up, and I suspect my colleagues are seeing something similar. Virginia's population is about 9 million. 70% of the Virginia population lives in something that we call the urban crescent, which is basically DC to Richmond along I-95, and then Williamsburg, Newport News, Hampton, Virginia Beach along I-64. We call that the urban crescent in Virginia. 70% of our population, 5.5 million people, live there. None of the closures, none of the at-risks for closures are in the urban crescent. They're all in rural Virginia, all of them. Shenandoah Valley, Appalachia, South Side, Northern Neck, potentially the Eastern Shore. And so this is what my providers are telling me. So that's data too. The overall growth of the program is data, but these are hospitals that have already closed, clinics that have already closed, and those that are threatened to close, and all of them are in rural Virginia because, as Mr. Schneider said, rural populations tend to have a higher Medicaid percentage in the payer mix, and they also tend to have a lower patient volume. So when you take, we already have a low patient volume, so we're sort of barely struggling, and then you take the core of our financial model and you make changes to it. That's why these closures are in rural Virginia and why they're likely to be. And I suspect states around the country are seeing exactly the same thing. The only real question that I want to put on the table, and I think it was Mr. Blaze, you said, one of the reforms we should make is have some uniformity in the program and then have any excess that's spent, that should be on the state's shoulders. So I know you're talking about, here's a program where the feds are, being charged by the state. I mean, and your argument is we should just have governors do more state taxes or mayors do more local taxes to pick this up, because if these changes are already leading to all these rural closures, I live in Richmond, I'm going to get service. But the 30% of Virginia that lives in rural Virginia, they're the ones seeing the closures. And if we were to do what you suggest, hey, forget all this federal money in the state, the SDP program, just as you say, put the excess costs on the states, then, I guess we could pat ourselves on the back and say we're bringing the cost curve down. But if we're just forcing states to increase taxes or mayors to increase taxes, I'm not really sure we're reducing costs. Instead, an awful lot of the most rural states where people are getting hurt the most are also the states that are probably least likely to be able to raise revenue at the state level to support these providers. So I'll just put my chart in with the others to say, this tells me we got a huge problem. If the closures are all in rural Virginia, and I suspect overwhelmingly in rural America, then as we're trying to figure out what the answer is, we better come up with an answer that solves this. Thank you, Mr. Chair. I yield back.
Mr. Blaze, he mentioned you. Do you want to quick respond to this?
Yeah, Senator, it's obviously it's a complicated problem. You had rural hospitals that were struggling before the reconciliation bill last year was passed. The Assistant Secretary of Planning and Evaluation at HHS did a study looking at rural hospitals that closed from 2011 to 2023 and found that their occupancy was really low and had been declining, and that the vast majority of rural hospitals that closed were adjacent to urban areas. I think that from thinking that your job is to best spend federal taxpayer dollars, and a lot of these programs, the provider taxes, the state-directed payments, the beneficiaries of those overwhelmingly are wealthy big hospital systems.
That's not what my rural hospitals are telling me about the SDP rule.
But I think the savings that you get from those broader reforms allow you to make targeted investments, which is what the Rural Health Transformation Fund is, and that's $10 billion a year.
Yeah, but it's interesting. These closures have happened even though there was a Rural Health Transformation Fund. They closed even though they knew that Congress had tried to provide a little bit of money to try to help bridge this problem.
I mean, I think the $10 billion a year is a lot of money, given the financial exposure.
Not
of
enough to
rural
stop
hospitals.
these hospitals from closing.
So again, I would never question the veracity of, people who get federal dollars. But I will point out when we passed one big beautiful bill, Wisconsin went from 1.8 to 6% provider tax because they wanted to, be part of the deal too. And I got lobbied by a hospital, said, you've got to lobby Dr. Oz to create a waiver so we can get that 6% provider tax, because if we do it, we can charge our patients $12 million and we'll get reimbursed for $18 million and we'll make a $6 million profit. That was the rationale. It wasn't like, hey, if we can't do this, we're going to go out of business. It's like, no, this is a money-making opportunity for us, and you've got to lobby Dr. Oz to, allow us to make that extra $6 million. So again, I would take what these providers who are getting all this federal money, I'd take what they say with a grain of salt. Senator Marino.
Thank you, Mr. Chairman. Thank you for having this hearing. There's an expression in sales that says facts get in the way of a good story. And obviously the Democrats want to stick with the story that Republicans are somehow for billionaires and they're for the working class, but obviously the facts are completely the opposite of that. Talking about rural America, they get wiped out in rural America. Rural American voters reject Democrats by wide margins. You would think that they would look at that and go, well, why is that? So let me give you a little bit of the answer. Your policies have destroyed American manufacturing. You allowed these jobs to get shipped overseas to China, Mexico, and our factories and places in Ohio got wiped out because of those policies. President Trump has put tariffs in place, which have brought these manufacturing facilities back to the United States of America, and yet they've fought tooth and nail every step of the way on tariffs. You allowed drugs to come into our border, across our border with impunity. We had a completely wide open border and allowed tens of millions of people to enter this country. Cheap labor, that doesn't affect billionaires. I don't think billionaires get replaced by illegals crossing our border, but working Americans do. They see massive wage suppression. And so those are the policies that they've put in place. And they actually shut down the government and wanted, one of the ransom notes was to get rid of the Rural Hospital Opportunity Fund. They wanted to eliminate it. None of them voted for it, and they wanted to eliminate it. Those are just facts. The ranking member talked about the mom with 2 kids. We're the party that cares about the mom with 2 kids. We're the party that gave that mom a $2,000 child tax credit. You voted against that. We gave that mom an $1,800 child tax credit. You voted against that. If that mom worked for tips or overtime, you voted against that. You're the one that wants to give able-bodied adults more money than those kids that mom has. I think a little self-reflection on that should be part of the equation. That those 2 things, just those 2 things, the child tax credit and the daycare credit, is $3,800 for that mom making $25,000 a year. That's real money that you guys did not want to give that mom. That was just your votes, and those are just facts. But when you did have control of Congress and the White House, what did you do? Did you help working Americans? No. You passed a law that gave $7,500 to the wealthiest 0.01% of Americans to buy to lease luxury electric vehicles. So while the mom with 2 kids is making 25 grand a year struggling, the person making tens of millions of dollars a year could go into a Rolls-Royce dealership and get $7,500 thanks to each and every one of you to lease a Rolls-Royce Spectre. Congratulations on that phenomenal policy. Mr. Snyder, if somebody's in this country without permission, should they be allowed to get health care on the backs of the American taxpayer, yes or no?
My own view is if people need health care, they should receive it.
So you think that somebody who is here illegally should have their health care paid for by the American taxpayer?
So we have a law in this country.
No, I'm just asking you, that's a simple yes or no question. Somebody's in this
I
country.
agree with
Somebody's, let me just restate it. So I don't
Yes,
want-
if they need emergency care, yes.
So the taxpayer, the United States of America, should pay for the health care of people who broke into this country illegally.
That's what Congress decided in
No,
1980.
no. Congress never decided. I don't know what Congress you're talking about. If you needed emergency health care and you went to any other country on earth, would you get it for free?
Well, the countries that I've gone to, yes.
You'd get health care for free if you went into a, so for example, let's take Spain, which has incredibly difficult visa standards. If you went to Spain and needed heart surgery, you think the Spanish government would give it to you gratis?
I can't speak to Spain.
But do you think but it's interesting. I wonder if my Democrat colleagues would agree with that. That if people who broke into this country illegally should get health care. Mr. Snyder, if somebody broke into your home, would you make them dinner?
No, I would not.
Why not? Why not? Why wouldn't you? They need help. What if they're starving? What if somebody broke into your home who's hungry? Would you not feed them? Or would you call the police and get them the heck out of the house?
If somebody was hungry and needed to be fed, I would feed them.
So if somebody broke into your house, you will feed them. Don't give anybody your address.
So
Whatever you do, I'm asking you just for
I'm
your
just
own
telling
personal
you,
sake,
if
do
I could
not
answer-
release your address.
Can I answer the
You
question?
can, please.
Somebody breaks into my home and they're hungry. I'm going to forgive them for breaking in. I'm going to feed them, and then we'll work out accountability for what they've done.
Okay. Like I said, don't release your address. But on behalf of the American taxpayers, especially the hardworking men and women of this country, no, government benefits, taxpayer dollars should be absolutely and exclusively reserved for American citizens. And so the party that says they care about working Americans, this is why you keep losing in rural America. This is why you guys get wiped out in places like that. Whether it's Virginia or Oregon, you do not win in the rural parts of your state. You get absolutely crushed because of that kind of philosophy.
Senator Merkley would like to make a comment.
Thank you. Just for the record, undocumented individuals are not eligible for Medicaid unless they're in emergency, going to the emergency room under very limited circumstances. And yes, those same services, emergency, are provided by many other nations if Americans are traveling abroad for an emergency service.
Mr. Blaze, very quickly, how many illegal immigrants do you think are on Medicaid? Not beyond emergency services, but on Medicaid. Do you have any estimate? In California?
In California, it's considerable. California got one of these provider tax schemes approved, and then the next got $10 billion in federal funds without any state contribution, and the next year expanded Medicaid to all unauthorized immigrants in the state.
Senator Lujan.
Thank you very much, Mr. Chairman. Coming into the hearing at the moment that I did really caught my attention as my colleague departs. You know, some of us are Catholic, and my colleague went to Catholic high school, I believe, if I'm not mistaken, someone that should understand the lessons that are taught to us every day. I'd refer my colleague from Ohio to teachings under St. Francis of Assisi if he needs to learn about what it means to shelter those that need some help, or provide food to those that need some help, or care for those that need some help. I grew up in a rural community. I didn't have a Rolls-Royce dealership. I still live on a small farm. I put diesel in my tractor. I turn dirt every day. I fix fences. When my neighbors need help fixing a fence, I go help them put that fence up. I don't ask if they're Democrat, Republican, whatever it may be, we do it. This lesson about how the big, beautiful bill, a piece of legislation that President Trump ran on, that my Republican colleagues are trying to fleece the American people in convincing them that this bill helps them. $1 trillion was taken out of healthcare. How the hell does that help anybody? I'm a stroke survivor. 4 years ago, I had a stroke. What I learned is time is not on your side if you have a stroke. You need to get to the doctor immediately. Well, Not in the case of what happens with the $1 trillion cuts and Medicaid facilities start closing and rural clinics start closing. And if that was not enough, then they went and devastated food programs in America, kicking farmers and ranchers in the teeth and closing rural grocery stores. That's the big, beautiful bill. They just voted on it. Facts are funny. Anyhow, this hearing is about Medicaid. The realities around Medicaid. If I'm not mistaken, the big, beautiful bill removed about $1 trillion from healthcare, more than $800 billion of federal Medicaid dollars. And my Republican colleagues profess that they did not cut, they being Republicans, did not cut Medicaid. They only transferred the cost to states. They eliminated $1 trillion in access to healthcare. Medicaid programs across the country, we don't know who's going to get care or who's not going to get care. I have constituents writing to me every day about a concern of being able to pay bills, trying to figure out if they're going to be able to get access to care or not. Dina from Bernalillo County, which is the largest county in New Mexico populace-wise, said, as I was sitting in urgent care this weekend, I started to have serious anxiety that next year I might be without my Medicaid insurance, and I may not be able to go to urgent care if I needed to. When the Affordable Care Act was passed, we had a Republican governor in New Mexico that did the right thing and embraced Medicaid expansion. It took New Mexico from one of the most uninsured states in the country to a state that actually people could get some coverage and have some certainty that care was going to be there. Democrats and Republicans should be working together in all these. If we're going to talk about reforms, let's talk about smart reforms. Let's talk about ways that we can get care to people in the most effective manner possible so that if someone out there has a stroke like I did, they're going to live and they're actually going to recover the way that I did. Because my recovery is also very unique. I was very blessed with that recovery, but it's because I had access to care. 8 million Americans have already lost health care coverage, including nearly 4 million who lost Medicaid CHIP, the Children Health Insurance Program. Now, Professor Schneider, are children protected from Medicaid cuts, as my Republican colleagues have suggested?
Over time, the large withdrawal of federal funding, close to $1 trillion over the next 10 years, that's in H.R. 1, everyone in the program is at risk.
How about
Children, people with disabilities, seniors, people in rural areas, people in urban areas, the providers that serve them, they're all at risk.
You anticipated my next question about seniors. I appreciate that response. I did not hear you specifically mention people with disabilities. I heard you say everyone, but what about people with disabilities?
Exactly the same situation. The states were expecting the resources that had been in place before H.R. 1 was enacted, and over the next 10 years, they're not going to have those resources available.
Now, coming from a rural community myself, hearing the question from my colleague that was speaking before me, are adults and children in small towns and rural areas more likely than those living in metro areas to rely on Medicaid CHIP for their health insurance?
Medicaid is a slightly more important payer for families and children in rural areas than in urban.
The same
It's
holds
important
true.
in both, but it's a little more important in rural.
I appreciate it. Well, this hearing's not on SNAP. The same holds true for SNAP as well. So look, Mr. Chairman, I certainly hope as the budget reconciliation debate is continuing on Budget Reconciliation 3, we're looking at access to health care. Costs are going up. You know, some folks try to refer to this as affordability. People just can't afford to get services and to get by. And that we should not forget about Social Security. I challenged my Republican colleagues at the last hearing we had on Social Security. Maybe in your next budget reconciliation bill, we'll actually see some language in there to make sure Social Security is solvent. And it didn't happen. Well, lo and behold, there's another budget reconciliation coming forward. So I look forward to seeing how Republicans are going to protect Social Security and make sure that it's going to be solvent in the next budget reconciliation package as well. I appreciate all the panelists and everyone here today for the hearing.
So a couple comments. Reconciliation can't touch Social Security. I've got to defend Lutherans. We're pretty compassionate too. And I would just remind Senator Lujan, take a look at the chart there. In 2014, the first year of Obamacare Medicaid expansion, we spent about $400 billion on Medicaid. 2019, we were spending, actually, 2014 spent a little $300 billion. 2019, about $400 billion. This year, we'll spend $668 billion, or 2025. This year, we'll spend about 735. So it went from 300 billion first year of Obamacare, 400 billion right before the pandemic, 668 billion last year, 735 billion this year. Again, I'm just not seeing where we're taking $1 trillion out of Medicaid. The costs of Medicaid are exploding. But with that, we'll turn to Senator Scott.
Mr. Chairman, could I respond to that? I ask unanimous consent to submit the analysis of HR 1 from CBO into the record, and that'll respond to your questions associated with the $1 trillion tax cut. Thank you.
I'm really high on CBO projections. Senator Scott.
All right. Thank you, Chairman. Thanks for holding this. Dr. Blaze. The Medicaid program was really originally set up, for seniors, children, pregnant women, disabled, right?
Correct.
And the reason it was set up the way it was that the federal government would pay a portion and the states would pay a portion, and the states would pay a portion out of their own taxes, right?
Correct.
Right. And I guess, it goes from 50 to, depending on the income level the states pay, from 50% to as little as 15% about?
Yeah, so for the traditional population, wealthiest states, they spend $1, federal government contributes $1. Poorest states, they spend $1, federal government contributes $3.
But for all states, wealthy or not, when Obamacare expanded to able-bodied adults, it was 90-10.
It was actually 100% for the first 3 years, and it's phased down, and it's 90 to 10 now.
So if you look at a state budget now, have states have they gained the 90-10 match to pay for things that have nothing to do with healthcare?
Yeah, I mean, states get 7 times more funding when they spend $1 on the expansion population than the traditional population, and particularly given that they can finance their state share with these legalized money laundering tactics, states use Medicaid to fund other state projects, and the ACA expansion, the 9-to-1, is a multiplier on the money laundering apparatus that states employ.
So have some states said, okay, gone to a provider and said, hey, you'll pay us some money so we can get extra money from Medicaid?
Yeah, in many cases, Senator, it's the provider that goes to the state and says, we've designed this scheme that's just going to plus us up with federal tax dollars.
So this concept that the states would put a portion to make sure the dollars are spent wisely, to make sure the people are covered, doesn't really work anymore.
That's deteriorated, yes.
Yeah, so I mean, when you think about it, if the federal government's goal was to make sure we take care of, especially the pregnant women, kids, disabled, the states have lost focus because there's so much money, and the providers have looked at, there's so much money out here for the able-bodied adults.
The federal government is encouraging states to discriminate against the most vulnerable.
Dr. Oz recently paused payments to California, noting that the in-home supportive service program has grown over 24% over 2 years, way more than the national average. What's noteworthy is that the funding of this program is 55% federal, about 35% is intergovernmental transfers, leaves the state only paying about 11%. Okay, so now I thought they were supposed to have a 50-50 match. So explain how that works.
So intergovernmental transfers, the most problematic ones are where you get a local health facility that transfers money to the state. The state then uses that as its payment back to the facility and then leverages the federal dollars. So it's a way for states to use the Medicaid financing system to benefit the government-owned providers at the expense of the taxpayer. And you have some examples where, like in California, they do this for their ambulances too, where they'll pay the government ambulance providers more than 3 times what they pay the private ambulance providers through the Medicaid program.
So that ambulance company has no risk. I mean, there's just extra money.
Yes.
They're just using the federal tax dollars to pay, because we should expect our states to have skin in the game. And what you're saying is what happens is they don't actually have skin in the game.
They don't have skin in the game, and they're lobbied. Like there is in the state capitals. I mean, you know this as a former governor. And former governors know this. You're lobbied by the special interests to design programs this way and take advantage of the federal taxpayer.
Mr. Ingram, the HHS Office of the Inspector General recently decertified New York's Medicaid Fraud Control Unit due to a year-long failure to do its job. Despite receiving over $60 million annually and having a staff of 270 people, New York was the worst performing unit compared to other states. This office was only able to secure 85 fraud convictions from 20 to 25, when the newest The next lowest scoring state had 237 convictions, almost 3 times more. New York had 49 criminal fraud indictments between 20 and 25, which is less than 10 a year. The next state had 268, 5 times more. It's not that fraud isn't there. Indiana and Arizona were able to secure 5 and 7 times as many indictments in 25 alone compared to New York's 7. How important is the Medicaid Fraud Control Unit program, and what does it mean when a state that is run so poorly like New York that only 1 conviction for patient abuse in 2025, despite having 2,000 patient abuse referrals a year?
Well, New York's fraud control unit under AG Letitia James has been horrendous, as you noted. It's one of the worst in the countries. You mentioned Indiana and Arizona. Those are states with programs, 1/5 the size of New York. They have about 1/10 the staff, 1/10 the budget, and they're delivering, 5 to 7 times more criminal indictments. They're delivering more convictions, more civil recoveries. New York had not a single hospice fraud investigation, despite that being sort of a hotbed of fraud in New York. It's not a new problem. It's been ongoing for years. It definitely worsened under President Biden. States are getting more funding from taxpayers than ever for these units and delivering worse results. Investigations are down, indictments are down, convictions are down, recoveries are down. Indictments in New York have dropped 93% since 2019. Over a dozen of these units recover less fraudulent funds than it costs federal taxpayers to operate them. So, this is a longstanding problem. Nobody really seemed to care until President Trump came in. He's doing something about it. New York was decertified, Hawaii was decertified, but a future administration could go back to the way things were under President Biden. So I would encourage everyone to codify stronger oversight requirements for these and really make them effective.
Thank you.
Senator Whitehouse.
Thanks, Chairman. We're here today because the billionaires bill will knock down Medicaid spending by somewhere in the neighborhood of $1 trillion. Some basic facts are the Medicaid money does not go to the Medicaid recipient. It goes to the people who provide the health care. It goes to hospitals. It goes to nursing homes. It goes to doctors. It goes to pharmacists. So when you drop that kind of a spending cut into our healthcare system, you're going to see real problems. And I think knowing that, Republicans set the grenade to go off after the election so that the damage to individuals was not front page news everywhere before the election. But what we are seeing is that the entities that receive the Medicaid funding are having to start doing their budgeting for the $1 trillion cuts. It's responsible to look forward. And as they're doing that, they're starting to say, oh my God, our numbers don't work anymore. The financials now for hospitals are being affected by the predicted cuts to Medicaid. The financials now for doctors' practices are being affected by the predicted cuts to Medicaid. And nursing homes have a particularly bad vulnerability, and they're starting to see those cuts as well. So we need to be paying attention to the forewarnings that the financial work in these industries are giving us about what the hell is coming at us. Because the grenade may be set to go off after the election, but it's still going to go off. And that's why we're living through this narrative creation effort to suggest that the problems with Medicaid are that it's riddled with fraudsters, people are crooked, and oh, folks, it has nothing to do with the billions and billions and billions in tax cuts that we gave in that bill to the wealthiest and highest income people in the country, some of whom, as billionaires, actually don't pay any taxes. Actually don't. That's, as Ms. Helmsley famously said, for the little people. And this body is highly responsive to those billionaires. And so, of course, out went the Medicaid spending, in went the tax cuts for billionaires, and that's why we are where we are. The device is employment reporting. It's to create a red tape bomb that makes it as difficult as possible for people on Medicaid to fill out the requisite paperwork so they can keep their benefits. That's the trick. That's the stunt that's being used to knock people off Medicaid. I don't know how many of my colleagues hang out with people on Medicaid. We're a pretty high-end group here around the Senate. But I tell you, around Rhode Island, who's on Medicaid? It's people with really significant learning disabilities. It's people with mental health issues that they're getting treatment for. It's people in addiction recovery. It's people with really severe health conditions that interfere with their ability to earn a living. It's people who have multiple health conditions, so many they can barely keep track of their multiple health conditions. And all of those people with all those conditions are now supposed to be experts at red tape so that they don't get pushed off by employment reporting requirements. It's kind of a dirty trick. And the notion that fraud is so endemic in Medicaid is a little bit belied by the fact that it's the only program that has a specifically dedicated fraud detection and prevention program. I was the Attorney General of the state of Rhode Island. I ran our Medicaid fraud control unit. Everybody had one. We didn't find all that much, Mr. Chairman, because Rhode Island's a small state. It's hard to set up a phony baloney doctor's office and run millions of dollars in payments through without somebody catching on real quick. But boy, was Florida a festival of fraud. It has its own Medicaid fraud control unit. They all do. Other programs don't have that discipline. They're not policed that way. So the idea that fraud is out of control in Medicaid, to me, is not credible. What is credible is how many people, individuals with significant disabilities, very often addiction, mental health, learning, so that they're able-bodied, are going to get clobbered by the red tape bomb that Republicans set to go off after the election. And the tell is the financials of the providers who are looking forward to what their financial world looks like when that grenade goes off. Thank you, Chairman.
I will point out that Governor Walz and Attorney General Ellison didn't find much fraud in Minnesota either. And also remind people of just the basic facts, and I'll repeat them again, probably do it again. 2014, the first year of Obamacare's implementation, Medicaid spent $300 billion. 2019, before the pandemic, spent $400 billion. Last year, we spent $668 billion, more than double what we spent first year of Medicaid expansion. This year, we'll spend $735. Again, I'm just not seeing these cuts. Again, I can do math. That is a out-of-control increase in Medicaid spending. Senator
Mr. Chairman, if we're going to argue with each of us after we've made our statements, I think we're entitled to reply. And I think it's important simply to reiterate what I said. There are a great number of Medicaid patients for whom keeping track of the new red tape employment requirements, the new red tape bomb that Republicans built into the billionaires bill specifically to knock people off. The test was how many people you could knock off Medicare. How can you reduce the spending by knocking those people off Medicare? And the selection is going to be the people who are most vulnerable, who don't have the skills to keep up with the paperwork and red tape bomb that's going to be set off in their lives. That's what we're dealing with.
We'd like to keep illegal immigrants off the Medicaid rolls. Senator Van Hollen.
Mr. Chairman, first we should be clear about this. There's nobody in this room that doesn't want to crack down on waste, fraud, or abuse. Every one of us recognizes that a dollar that goes to fraud is a dollar that is not going to somebody who needs the the help. And I don't think there's a person in this room who disagrees with that statement. I do have to question why the Trump administration, in its very first days, eliminated the inspector generals in a whole bunch of departments, including the inspector general overseeing HHS. If you were really interested in going after fraud, you wouldn't be firing inspector generals in the US government, which is exactly what they did. So what this hearing is all about is let's pretend. Let's pretend that the $1 trillion cut to Medicaid that Republicans here in Congress and the President of the United States made in what they called their big, beautiful bill, let's pretend that $1 million was really going after fraud, as opposed to hurting tens of millions of Americans. I didn't make up the number. The Congressional Budget Office, the nonpartisan Congressional Budget Office, told us that 7.5 million Americans are going to lose access to health care because of the cuts to Medicaid. There are another over 2 million who are going to lose access because Republicans took away tax credits for the Affordable Care Act. Again, that's a CBO number, and actually tells us what their real goal here was, right? Because as part of that big, beautiful bill, they gave billionaires and very rich people permanent tax cuts. It was beautiful if you're a billionaire. I just want to show what the distribution of those tax cuts was right here. If you look at the tax cuts, 22% of the benefits of the Republican bill went to the top 22%. 72% of the benefits went to the wealthiest 20%, and that number will get bigger over time because Republicans sunset the few tax benefits that went to working people, just as they eliminated the one tax credit that was available to middle-class folks trying to afford their health care. And despite the cuts to Medicaid, they still had a $4.2 trillion deficit over the next 10 years. This is a budget committee. I'm all for looking at honest ways for reducing our deficits. You don't do that by giving billionaires and big corporations huge tax cuts. So let's look at these Medicaid cuts because in addition to the 7.5 million Americans who are going to get hurt, you're also going to have a spillover effect on probably every American. Mr. Schneider, maybe you could tell us what happens when somebody who doesn't have Medicaid coverage and doesn't have preventative health care coverage gets desperately sick, waits until they have to go to the emergency room. Who ends up having to cover the costs of that uncompensated care at the end of the day?
Well, what usually happens is the patient ends up getting a bill that may throw the patient into medical debt. The hospital that's providing the emergency care has to cross-subsidize that service, and it will find the money for its operations from other paying patients.
So, right, let's unpack what you mean by cross-subsidize, right? What you mean is that people who are not on Medicaid, people, for example, who are on private insurance, people who are paying their premiums, at the end of the day, they're going to have to pay more, either in higher premiums or co-pays, in order to compensate for the uncompensated care. It was the care that was denied to the person who was on Medicaid. Is that right?
That's correct.
Right. So I think it's important to understand that in order to provide these tax cuts to billionaires and corporations, Republicans not only cut access to health care for 1 million people, 7.5 million people in Medicaid, but they're also going to be pushing the costs of that harmful action onto everybody else. And again, all for the effort to give these very rich people a big tax cut. And I will just say, Mr. Chairman, that the cuts to Medicaid were very cynically timed. Most of them, if not all of them, don't take place until January of next year, after the election. I wonder why that is. It's because the American people are going to hate what they see, and they're going to be feeling it in their pocketbooks, and Republicans want to delay that until after the election. That's what that cynical timing was all about. Again, all in service of giving very rich people big tax cuts. Thank you, Mr. Chairman.
So first of all, the reconciliation bill primarily prevented a massive automatic tax increase. We cut taxes for virtually every American taxpayer back in 2017, 2018. When Democrats had House, Senate, and the White House, you could have reversed that. You didn't. You didn't increase people's taxes, neither did we. So again, to call that a massive tax cut, it wasn't. We prevented a massive automatic tax increase, which would have been devastating for our economy. So again, let's talk about it honestly in terms of what that reconciliation bill did. There were some additional tax cuts, yes, but the trillions of dollars was a automatic tax increase that would have impacted every American, and you didn't want to do it, and we didn't do it. So that was kind of bipartisan. We didn't want to increase taxes. So,
Mr. Chairman, if I could just have
go ahead.
30 seconds to reply.
Then I'll refute that.
First of all, as you know, Mr. Chairman, when we passed the Inflation Reduction Act, we actually did close a lot of tax loopholes on very wealthy corporations that were moving
You didn't reverse the
jobs
2017
overseas.
tax cuts.
With respect to the earlier tax cuts, they were lapsing on their own. They were going to go away on their own. And all of us were prepared to have those for very rich people lapse on their own as they should have. So you saw the chart, the overwhelming benefits from those tax cuts go to very wealthy people. And we actually specifically proposed that they lapse for those people.
I would say, but not increasing tax on the American economy and benefits.
Well, these were tax cuts that were put in place, as you pointed out, right, during the first Trump administration, disproportionately helping the very rich. We wanted to allow those to lapse. Republicans didn't. I mean, that's the end of the story.
Okay. Senator Murray.
Thank you, Mr. Chairman. I think we can all agree we do need to crack down on fraud, especially in a program like Medicaid that so many Americans really rely on. So, Mr. Ingram, let me just ask you yes or no. You agree we do need to be cracking down on Medicaid fraud and not letting criminals off the hook, yes?
Yes.
Thank you. So I hope my Republican colleagues will use some part of this hearing to condemn President Trump for pardoning criminals who were convicted of major Medicaid fraud. Trump pardoned 5 former executives from Florida who committed serious Medicaid fraud to the tune of tens of millions of dollars. That is pretty bad. Following what was dubbed, quote, the largest healthcare fraud scheme charged by the U.S. Justice Department, valued at over $1 billion in Medicare and Medicaid fraud, Trump commuted the 20-year sentence of a Florida nursing home and assisted living facility executive. So that's even worse. So look, I'm all for major crackdown fraud. I think we all are, but it looks like we've got some pretty good leads starting in the White House. Mr. Schneider, I want to turn to you. What single piece of legislation delivered the largest cuts to Medicaid in American history?
Last year's budget reconciliation bill.
Yep, so everybody knows Republicans' big ugly bill passed more than $1 trillion in healthcare cuts, mostly to Medicaid. Mr. Schneider, how much in tax breaks for the top 1% did Trump's bill contain?
Approximately $1 trillion.
$1 trillion in tax cuts to the top 1%. Mr. Schneider, how many Americans are losing health care because of Trump's big ugly bill?
So in terms of the Medicaid cuts, the latest estimates are approximately 11 million.
11 million. So 0 billionaires lose their health care. They do get $1 trillion in tax cuts. And then over 15 million Americans, including the extended ACA tax credits, lose their health care thanks to Republicans passing $1 trillion in cuts for regular working class people. That is the math, and that is out and out grift. So it seems to me like the biggest Medicaid theft didn't happen in a billing office somewhere. It actually happened last year right here in the United States Capitol when Republicans passed Trump's big ugly bill. So, Mr. Chairman, let me just say, I find it pretty astounding that Republicans are holding an entire Senate hearing on fraud in Medicaid, but they don't seem to have anything to say about the fraud coming out of the White House. I mean, look at the crypto schemes and the foreign gifts. That's easily the most corrupt White House in American history. So the President Trump pardoned convicted criminals who committed Medicaid fraud. This is outrageous to me, and it is what we should be talking about. But I also want to note a really big difference in terms of values and beliefs right now. because I am here, and I know my colleagues on this side are, to fight for our safety net programs, but my colleagues on the other side of the aisle are not with me on that fight. Chairman Johnson has said repeatedly he believes Social Security is a Ponzi scheme. Last week, another Republican senator was on the floor saying Social Security is a scam. So I wanted to make really clear at this hearing, I cannot disagree more strongly, Mr. Chairman. Social Security is a program that millions of hardworking Americans have paid into their entire lives. So Republicans might want to cut benefits or privatize Social Security, but I want you to know I'm going to keep fighting to save Social Security and protect health care for our Americans now and long into the future. Thank you, Mr. Chairman.
So to correct the record, I've said it's a legal Ponzi scheme, which is exactly what it is. I mean, take a look at what a Ponzi scheme is. That's what Social Security is. It's been horribly mismanaged. Those funds were not invested in something that's valued the federal government's government bonds. I'm happy to, and we'll probably hold a hearing on this, and I'll prove the case, but it's a legal Ponzi scheme, and that's quite honestly indisputable.
Mr. Chairman, to respond.
Yes.
And welcome to the chairmanship, but
Thanks.
I find that you are turning this into a debate committee, not a budget committee. That's fine.
Well, I
But
know.
let me just
I think
respond.
it's important the American people
Fine.
see a civil
You have a right as
exchange,
the
but go
chair,
ahead.
but I will respond. Americans pay for their Social Security. They pay into it for their lifetimes, and they deserve to know it's going to be there in the future. That's what we're focused on.
Yes, and they
Thank you.
paid into it, and the money was spent, it's gone, it's been horribly mismanaged. And again, you take a look at the Social Security tables, and some people don't even get back what they put into it. Other people get up to 3 times what they put in. So again, we'll lay out the facts for this. That's all I'm trying to lay out the facts. This is a hearing about laying out the facts, and I'll go to Senator Wyden.
Mr. Chairman,
Yes.
point of privilege. It's customary in a Senate committee for each member of the Senate and each member of the committee to be able to ask their questions and make their points without an intervening rebuttal by the chair. I'm not anticipating doing an intervening rebuttal of Republican members. I'm not going to take up the time for that. I'm not going to ask for that. I just think that, and I did ask if I could put in a point for the record earlier, and you allowed me to do that, clarifying that undocumented individuals do not qualify for federal benefits. But I hope the point my colleagues have made is that is a new norm, but maybe not a great norm for this committee.
Well, I would disagree. I think it makes the hearings more interesting and more informative.
Are you going to
So again,
grant?
I've allowed an exchange back and forth.
Are you going to
asked, and
grant
I've-
me to intervene after every Republican testimony to point out how
For-
wrong they are and
first of
how
all-
off base they are?
Okay.
Because that would be the equivalent point.
Senator Wyden.
Thank you, Mr. Chairman, and I certainly share Senator Merkley's view on this point. And the reality is, on this side, we have been trying to work with Republicans on fighting healthcare fraud again and again. You know, I went to the floor repeatedly to point out, for example, insurance broker fraud, something that both of us ought to come together. No response from Republicans. So today, we're looking at yet another approach that is ill-advised because it primarily hurts people and doesn't do anything about reducing fraud or anything like that. And that's the administrative trap designed to disenroll folks who are eligible for Medicaid. And the Trump administration went forward to basically say that they were going to literally require people to prove that they're sick enough to deserve health care. So today, Senator Warnock and I are releasing a letter signed by each Senate Democrat urging the Trump administration to pull back on this disastrous rule that would harm so many vulnerable people. So this, by the way, is the same sort of approach that House Democrats have taken to raise the alarm on this flawed and hurtful rule. I can't remember the last time that we had such unity between the House and the Senate, but I guess if the Republicans are just going to keep hurting people, you'll see it often in this session. I'd like to ask, Mr. Chairman, that these letters be entered into the record.
No objection.
Thank you, Mr. Chairman. Now, Andy Schneider may not be known to everybody in this room, but I sat next to Andy Schneider when he was starting his career in healthcare, and he was fighting for people who were vulnerable, people who walked an economic tightrope and balanced the food bill against the fuel bill and the fuel bill against the rent bill. And he's still doing that. My God, this is a man who could probably go out to any mega corporation and pull down a gigantic salary. But instead, what he's doing is putting his heart out there once more for people who are walking that economic tightrope. So before we wrap up, I think it would be great to have Andy Schneider give us a real-world example of the human cost for the millions of Americans who are losing their health care as a result of this bureaucratic razzmatazz. That's the most complimentary thing you can talk about because it really is bureaucratic unfairness. But tell us what it means to people who are, hurting and vulnerable that you've been fighting for, by my calculus, for almost a half a century going to bat for people who didn't have clout and didn't have power.
Thank you, Senator. I appreciate that. And I fondly remember our days in midnight basketball in Portland.
Don't talk about my Gray Panther days.
Okay, I withdraw that comment.
Thank you.
You had a great dunk, though. Good. So let's take what is the unfolding story here of work reporting requirements being imposed on all Medicaid expansion states for Medicaid expansion adults. And one of the first states out of the box is Nebraska. And there was a piece yesterday or the day before reporting on some of the early administrative red tape problems that Medicaid beneficiaries are going to face as this unfolds.
It's a backdoor disenrollment program, isn't it?
Well, I think that's a fair characterization, yeah. So in this particular case, a pregnant woman was disenrolled from the Nebraska Medicaid program because the enrollment staff didn't understand that she was pregnant. So it eventually got sorted out, as far as we can tell from the reporting, but these kinds of errors are almost unavoidable given the complexity and cumbersomeness of the new rules that are about to go into effect.
Well, I thank you for putting a human face on this. We're going to be calling on you in the Finance Committee as well on the same point. And before I close out my time, Mr. Chairman, Ranking Member Merkley asked members on the dais to share stories from our states, from families who rely on Medicaid. I'd like to enter into the record the letter from 11 U.S. senators to Dr. Oz that highlights families all over the nation, from one end of the country to another, who need help, need assistance with community-based services, and particularly need Medicaid. I ask unanimous consent that I close out my remarks with that.
Without objection. Thank you. So I think we'll bring the hearing to a close. I want to thank everybody, all the witnesses, everybody attending. Listen, I'd like to have a little bit more discussion. I think I've been civil. I'd like to maintain civility. I think it's going to be more interesting for the American public if we can exchange views. Again, there's obviously a big difference in perspective on this thing. That's fine. But let's discuss it, okay? And just the rigidity of the standard hearing, this is said. And again, I think it is far more interesting. I think it's far more beneficial to, let's have a discussion. If there's something that's you want to challenge, go ahead and challenge it with civility. So again, that's the way I intend to do this. I keep my comments pretty short. I don't filibuster. You just take a look at my opening statement. I think it's pretty short. But there are important points to be made, and I'll continue to do that. So I hope it doesn't offend my Democrat colleagues, but that'll continue to be my intention here.
Mr. Chairman, I'll just point out that a discussion involves other members having an equal time to provide rebuttal as well. Otherwise, it's just rebuttal.
And again, I gave, when I rebutted, I gave the Democrat member time to rebut what I said as well. So again, I've been here 15 years. I've seen chairmen handle different things, including the esteemed former chairman of our Finance Committee. So again, I think that's,
Could I provide one fact before we close? Just a fact.
As long as I can rebut it.
You can. You're most welcome. You're most welcome to. So that family of a mother and two children, that's earning 100% of federal poverty level. That's $2,276 a month. After payroll taxes, the disposable income is $2,100. and average rent for a 2-bedroom apartment, not even a 3-bedroom, children don't get their own room, is $1,700. Average cost for transportation, around $500. Already, you're down to $0. $0 for that family. Now, you made reference to $50,000 in benefits. A family does qualify at that level for $785 for SNAP, $0 for TANF, and there's a massive waiting list for affordable housing, so that's the luck of the draw, if you will. So most families are in the situation where they're completely out of money other than the assistance to help them buy food. They don't even have money to add into that, and this is before we start looking at a family has to buy utilities, they have to put clothing, they have to have school supplies. And so I just want to point out that, as one colleague observed, very few people in this room have lived at that level of really minimal resources. And so having Medicaid available as health insurance to those families, if we want that next generation to thrive, is essential.
Well, I will say people on this dais, including myself, came from very humble beginnings. Senator Graham, Senator Scott. So I think we understand this. I was quoting Senator Phil Graham, who's also a pretty noteworthy economist in his studies, talking about $53,000 in tax-free benefits for a single parent with 2 children, making $11,000. Again, I'm just quoting him, so to take a look at his information. But facts are facts, and I think that's what we need to try and do, is let's get the facts on the table, find out what we all agree on, common facts, and then we can kind of debate the different perspectives. But again, I appreciate everybody's involvement here. The hearing record will remain open for 15 days until August 19th at 5 p.m. for the submission of statements and questions for the record. This hearing is adjourned.